Hey you guys, happy Monday. I just got off the call with a few patients, but I just wanted to share with you, last week was super busy, but I actually had intentions of sharing a series of lab results. I just want to show you how many thyroid labs come back abnormal for me just in a week, to get an idea of how frequently and how easily this can get missed if you're not doing a full panel. And as a side note, one of these sets, which I'm not going to say which, are mine. All right, here we go. So this T4 is clearly out of range. The TSH showed normal, but then we ran it and it's obvious that it's out of range. So they never would have known that they're hypothyroid had we not run the T4. Now the next set and the next few, for example, so this person was flagged. This is actually a pediatric level, so the reference ranges are slightly different. So this is flagged at an 11, even though in adults normally wouldn't be, but still low. And the doctor had only run the TSH, so this would have been missed. Same with this set of labs. This patient's TSH was run. 11.2 is still not fab. You're not going to feel great at this level, even though it's not flagged by Life Labs or whatever lab you're getting your blood tested at. You're still feeling not hot. Again, repeating on itself, this 11, it's a very common number, not feeling great. And as you can see, the TSH is pretty perfect. So again, this person would have been told that their thyroid's fine and they would have been sent home. And then this set, same. 11.7 though, a little bit better. You still don't feel great. You need to be minimum a 12, but optimally 14, 15 for T4. And then I think there's just one last set coming up here. This one actually shows truly what TSH should look like if T4 is going down, though the previous lab show that TSH sometimes looks fine, but T4 is low. But a 3.33, you're suspicious that hypothyroid is starting to develop. And that's what that showed. And then this one's funny, 0.1 above the reference range. So it's a 10.7. The cutoff at the bottom is 10.6. Yes, this was my blood work, summer of 2023. Okay, so that's a lot. I figured after I posted that, I should probably explain that a little bit. So as you'll note, not everything is flagged or out of range. And that's one piece that kind of sets what I do apart from a regular medical doctor, is that although things might be within range, it doesn't mean that it's normal. But not only that, it's what we test to catch that stuff. For those of you who have been following along for a long time, I know that you are like overly educated on the subject, but for those of you who haven't been following along that long, I'll kind of break down the thyroid and testing and how that works and why we need to go a little bit deeper. So, what your medical doctor normally tests is TSH. So that's something that's produced in the pituitary gland in the central nervous system. And that essentially is just a signaling molecule to then send a message to the thyroid to tell the thyroid to produce active hormone, which is T4 and T3. T3 is the more metabolically active form, and a lot of the T4 that we produce is converted into T3, but you need a healthy functioning liver and a healthy functioning gut to have that conversion happen properly, as well as the right micronutrients to support that process. Now, your medical doctor just tests TSH, but TSH isn't the active hormone. And sometimes TSH can look normal or even be just about out of range, but that still is showing if that level, the TSH level is getting higher, that is a sign of actually hypothyroid, which is confusing. But the reason why it gets high is that the brain is having to send a stronger signal to the thyroid to get it to do its job, to produce enough T4. But as T4 levels go down, T3 levels go down, it feeds back and then it has to send a bigger signal. But sometimes there's a disconnect. TSH is actually perfect, but T4 or T3 or both are low. And that's why the full panel is necessary. And that's why so many people with hypothyroid get missed. So I'm not going to get into like all the whys, why does it happen, into like Hashimoto's, which is autoimmune stuff. Thyroid's a huge topic, but just know if you haven't been tested and you feel like you're presenting with symptoms of like mood concerns, low energy is huge, change in hair, skin, and nails, things like that, definitely consider this as something that it might be worth getting screened for.